So the case that I wanted to present to kind of stimulate some discussion is a case that I think is just interesting with regards to uh, cardiac device reaction, kind of an educational and unusual finding, but also something that I think is a helpful application of the kangaroo pouch and something that we thought was a good use of it in this specific case. So just to describe the case on the next slide, the case is of a 77-year-old gentleman with the initials DN. He has senile cardiac amyloidosis, some valvular heart disease, sinus node dysfunction, PAF is kind of common with the amyloid patients, as well as some heart block, and so underwent a dual chamber pacemaker in the left pectoral area in 2014 by one of my colleagues. The device, the details are listed here. So then he presented in April of 2018 with knee pain, and in the ER was incidentally found by the ER physicians to have 2 weeks of left chest erythema, which he felt fine with and didn't have any symptoms from. So I met him at this time when we were called because there was concern for a pocket infection and a need for a full system extraction. But when we went to see him, as you can see on the picture on the right-hand side, the picture was a little different than what we would expect for a classic pocket infection. He hadn't been instrumented in years. It looked pretty benign. He was otherwise well. And on discussion, he has had this erythema that's been coming and going for years since the implant. Every few weeks it comes and then it goes away, and he's been largely unbothered by it. So we were a little skeptical of a diagnosis of a pocket infection. We looked at the erythema, and like I mentioned, it was asymptomatic, and he had no other kind of systemic symptoms of infection. It had been recurrent, as I mentioned, the most recent episode being 2 months ago, and his other workup seemed very, very benign and not consistent with a pocket infection. So we called dermatology to see if they had any insight, and what they felt was that this was most consistent with a diagnosis known as reticular telangiectatic erythema, which is a really benign, safe, cutaneous condition which manifests as both localized area of blanchable erythema and telangiectasias. And this is actually a relatively uncommon but reported finding in the literature associated with pacemakers and defibrillators in the chest wall. This term has been described as telangiectatic pacemaker erythema and a somewhat kind of a rosacea-like manifestation, and honestly requires no treatment and kind of comes and goes. We spent a lot of time trying to understand what the mechanism of this might be, and in a literature review, I think it's fair to say that there's no clear answer, but most people believe it's related to some abnormal microvasculature, something wrong in and around the foreign body as the way it's healed into the patient's subcutaneous tissue. So about a year later, we sent him home and he was doing well. About a year later, he unfortunately developed a malignancy, lost a lot of weight, and became bacteremic from a peripheral IV used for his chemotherapy while he was immunosuppressed. He had an infected foot ulcer that was also noted around the time, which was actually the nidus of his malignancy. He had a bone osteosarcoma, I believe. Because he had staph bacteremia, we actually extracted the device at that time, and I'll note the pocket looked fine, looked normal. And after an appropriate time, we decided to place a new dual chamber pacemaker on the contralateral side on the right chest and used a kangaroo pouch at that time. Now, the reason we used a kangaroo pouch and we thought it might be helpful in this case was a couple of reasons. One was, like I mentioned, the patient had malignancy, infection, and become quite cachectic in the interval, even thinner than the picture on the right shows. And so we were worried about the risk of an erosion. We just thought about whether we should just put a submuscular device, but given he was on anticoagulation, thin, otherwise unwell, we thought just doing a standard position, prepectoral position of the device with the kangaroo pouch as another layer to protect from erosion might be a helpful thing. And that's what we ultimately decided to do. We also were curious if this pacemaker erythema was related to abnormal microvasculature around the device, was there something that could theoretically improve the healing, a more natural healing of the pocket around the device would reduce the risk of having this on the contralateral side? We put the device in, and over the following 18 months, he's been well without recurrence of that erythema. He's had, even though he's continued to lose weight, has not had any issues with erosion, and he hasn't had any other issues with infection. I will say that we utilize the kangaroo pouch by soaking it in a solution containing vancomycin, which potentially we feel might be helpful for the reducing of localized infection as well. So I think for those three reasons, we thought that the pouch would be helpful, and obviously a little bit of an interesting application with regards to reducing microvasculature, poor healing, but something that at least in one patient seems to be a different physiology in how his device has healed. I'll stop there, and I would love to hear if other people have thoughts about the utilization of the pouch here or other aspects of the case. Thank you.
Sonny, I had a question. You probably never did it because you didn't re-access that side for a device, but was he occluded on that side? Because it looks like he was occluded. I mean, if you looked at some of those pictures, those spiders and areas, I would think looked like someone who had a chronic, subclavian occlusion or axillary occlusion.
Yeah, I think you're right that I think he was occluded. We did put a temporary pacemaker through that area, but I think that was through the extraction sheath, if I remember correctly. So yeah, whether or not that global kind of macrovasculature affects the microvasculature and whatnot, I think is a very interesting point. But yeah, I think that's right.
I'm glad you presented this case because I actually had a lady who was referred to me a month ago, almost the exact same thing. And it was a 2-year period of time. She had had that exact same waxing and waning discoloration at the site. And she had seen me previously for consideration of extraction. I went through the entire workup, and lo and behold, when I saw her in clinic, there was nothing wrong with the site. And she came in again a month ago, pretty much the exact same picture. And I actually referred her to a dermatologist because I did not see anything wrong with the site. She does have a history of the device has been in there for about a 6.5-year period of time. She had a knee replacement about 1.5 years ago. And she had another procedure done on the opposite knee 2 years ago. And when she started developing issues with the site, then she initially thought that it was an infected pocket. But nothing that I did in terms of a workup would indicate that. So from the first office visit and also this one, I declined anything other than an evaluation by dermatology. But I'm glad you presented this.
I think that was a very interesting case. In my mind, of course, hindsight is 20/20. But regarding the dermatologic manifestation, I'd be curious to see what her immune response was if you were to take a histologic sample of one side versus the other. I've seen maybe 1 or 2 cases of nickel allergy or allergy to the device, to the generator itself, and I think the baseline immune system of the patient, whether or not those circulating immunoglobulins or if it's a mast cell reaction or of some sort, can just be some sub-level that ultimately gets activated when the immune system becomes susceptible, which then waxes and wanes as our immune system usually does from time to time. So I think there, it may be a combination of the dermatologic response, the immune system of the patient, and then the reaction of the local cells in and around the capsule area. But what's in my mind, what's also interesting is the reticular pattern and the diffuse pattern, because it wasn't just in the area of the generator, like Ken mentioned.
It's the entire chest, and that's the exact same manifestation of the patient that I saw. And that's also another thing that kind of clued me in and said I did not think it was just the pocket. It couldn't be, and the device had been in there for many years. But you're right. You're right.